My name is Samantha Gonzalez, and my video surrounds COVID testing, what it is, when to get tested, and how exactly it will work. So these are 4 questions you should be able to answer after this is done. What is COVID testing? Rapid and PCR, what's the difference? What is an antibody test? And when exactly you should get tested. So the basics of COVID testing, what you may think of when you first hear COVID testing is basically this image below. So a medical professional will insert a 6-inch cotton swab into your nose. This is usually between your nasal cavity and your mouth. These type of COVID tests are categorized into 2 different categories: COVID testing, not COVID testing, rapid and PCR COVID tests. So how these work is that when you get tested through your nose, they use these samples and they send it to a lab. Now, they molecularly see if you have COVID, but not all COVID tests use PCR or the polymerase chain reaction. But those who do are the most reliable COVID tests in this category. These are almost 100% accurate, and but there are other methods to test if you have COVID molecularly. Another way is through rapid tests or antigen tests. These are using your sample that the medical professional has provided, that they basically test the outside of your mucus to see if you have COVID or COVID antigens. This is also a great way to see if you have COVID, but keep in mind it's far less reliable than a PCR. It has a rate of 20% for false negatives according to UC Davis. But if you are in a jam, a COVID rapid test takes 15 to 30 minutes, while a PCR test takes 3 to 5 days. But I suggest if you can, take both. This is how your results may look. If you're in range and not detected for your PCR test and you do not have COVID, you're negative. But if you're in range and COVID is detected, then you are positive. Well, rapid tests are way more straightforward. You can't see right now, but they usually just say positive or negative. An antibody test is usually administered to somebody who has COVID or maybe have experienced COVID symptoms in the last couple of months. This usually works as just routine blood work. They stick a needle inside of you and they take a blood sample. And how this works is that through this blood sample, they see if you have COVID antibodies. And these COVID antibodies work is when if you had COVID, your body will fight off this COVID by using these antibodies. And this just detects if you ever had COVID. This is how your antibody test result might look like. Here's your name, and here is your results. This makes it look a little bit confusing because there's a number here, but you should not be alarmed. If your reference range is anything above a 1.4, it is positive. If anything below, it's negative. But one thing you should be paying attention to, if it's negative or positive, that's the main focus of this test result. Don't try to focus on the number. It's not that important, I assure you. So when exactly do you get tested, you may ask? So for a PCR rapid test, you might want to wait 5 to 7 days after exposure because COVID takes a while to but to come up and test. Waiting 5 to 7 days might ensure that your COVID tests are the most accurate it can possibly be. Antibody tests, you have to wait 3 weeks at minimum after you've gone over COVID, like you've tested negative, after you tested positive. These are the 4 questions you should be able to answer again. What is COVID testing, rapid and PCR? What's the difference? What is an antibody test and when to get tested? Now, keep in mind there are other COVID tests. These are just the most common forms that are administered. And I want to thank all of you who've listened to me. And I wish all of you guys have a magnificent day.